The medical community understandably concerned as we head into the Christmas and New Year's holidays, hoping we don't see a surge similar to or worse than the one that came with Thanksgiving. And we're talking about that tonight with Dr. Daniel Koritzkis, Chief of the Division of Infectious Diseases at Brigham and Women's. Thanks for being here.
Good to see you, Emily.
So the positivity rate in Massachusetts, it's about 6%, but it's higher when you remove those repeat surveillance tests. So we have 82,000 active cases right now. Can you tell us what happened in the past couple of months leading us to this point, and how do we stop spread from here?
I think it was a number of factors that converged to create a perfect storm. People were coming more gathering more indoors as the weather got colder. We were seeing lots of travel into the state and out of state and returning to the state over the Thanksgiving weekend. And people are letting their guard down and being indoors in closed spaces with lots of other people outside their households without masks on. And that's really accounting for the surge, I'm afraid.
Letting their guard down. It's an interesting point there. There are about 3,000 or more new cases reported every day. When we hear that number, can you put in perspective for us the amount of infected people who typically end up needing to be hospitalized or in the ICU?
Yeah, so over the last 7 or 8 days, an average of 230 people a day have been hospitalized because of COVID-19. That represents somewhere between 7 and 8% of people who are diagnosed each day. It's skewed more towards older people, but the more people who get infected, even if the bulk of them are younger, there's still some young people getting hospitalized, and they're transmitting to older people who have a much greater risk of being hospitalized.
And we know that that can impact capacity. We've been talking about hospital capacity these last few days. What's the discussion among your colleagues and maybe other hospitals in Boston about what to expect in the next couple of weeks?
Well, everybody's really quite anxious. We're just holding our own, just keeping our chins above water, as it were. But we worry that a surge on top of the current surge could really tip things over the edge in terms of going back to where we were last April and May with just huge need to expand ICU capacity in particular.
So I know that the answer will be, don't gather, but a lot of people are still asking this question. The holidays are almost here. Is there a safe way to have an in-person holiday with parents, grandparents, extended family? Is it possible at all?
With the holiday really beginning tomorrow, if you haven't already been quarantining for the last 14 days and know that you're consistently negative, it's really impossible to be safe unless you're going to be gathering by Zoom or some other platform, or if you're all going to be masked and outdoors.
Sacrifices now mean that we have next year. I guess that's
Absolutely.
the message. Yeah. Okay.
That is the message.
All right, Dr. Koritzkis, thank you for your time. We appreciate it. Happy holidays to you, and we'll see you next week.
Well, happy holidays, Emily.